All right, so good evening, everybody. Thank you so much for joining us tonight for this Vaping Unveiled presentation. My name is Andrea Smith. I'm going to be your moderator this evening, and I am here representing both All Together and the Greater Sullivan County Public Health Network. I am a substance misuse prevention coordinator for the Upper Valley. So if you ever have any substance misuse prevention needs, I'm the person that you can go to. Before we begin, I'd like to just go over a few housekeeping items. The first is that this session is being recorded for people to be able to view over the next few weeks in case they could not attend this live. Second, we ask that everyone but our presenter, please keep yourselves on mute throughout the evening in order to limit the background noise. There will be an opportunity to ask questions towards the end. Feel free to write a question in the chat though, just so you don't forget it, and then Kim will try to answer it again at the end of the presentation. And finally, I'd like to thank Kim Coronis, the Policy and Program Manager at Breathe New Hampshire, for taking the time to present this important information to our communities. And with that, I will pass it over to you, Kim, if you'd like to share your screen.
Okay, thank you, Andrea. I think it should be in PowerPoint mode on your end. Does it look okay?
Yep.
Okay. And I'd like to thank the guest also, and thank Andrea for the invitation to present and share our information. Breathe New Hampshire developed this Vaping Unveiled program over 3 years ago to address what we saw as a need as far as education. We are a lung health organization. We're a nonprofit here in Manchester that covers the state of New Hampshire. And obviously, as a lung health organization, we're concerned with all types of tobacco and nicotine use. We address things like asthma, COPD, which is chronic obstructive pulmonary disease. We do some clean air initiatives. As policy and program manager, I actually do work on some legislation and at times have to be our lobbyist up at the State House and Legislative Office building. Probably those are some of my tougher parts of my job, trying to get legislation passed. We work with a lot of public health partners to try to do different things, again, that affect health and lung health. One of our supporters of this particular program and why we can offer it at no cost to schools and other groups is from funding from New Hampshire Charitable Foundation. So we just want to recognize them. This evening, these are the sections or what I'm going to cover in this PowerPoint. As Andrea said, I'd just like to get through the slides first and then answer questions. If something really stands out, Andrea can let me know and we can stop. But if you can wait till the end, that would be great. And if I can't give you an answer, we will try to find an answer for you. And there may be also questions that you have that are specific to your areas that maybe Andrea would know more about than I do. Because again, our PowerPoint is trying to share information for the state of New Hampshire, not specific to Manchester and not specific to any particular school district. So overall, what is vaping? You've heard about it for years now. It's inhaling and exhaling an aerosol. Again, we like to focus on that it's an aerosol with especially young people. It's not a water vapor. This aerosol is produced by different types of battery-powered devices. You've heard terms e-cigarette, vapes. There's a lot of different product names that are out there. All of these devices have a couple things in common. They take nicotine, flavorings, and other chemicals and turn them into an aerosol. Again, there's a bunch of different names out there. The devices are shaped a lot differently nowadays. The e-cigarette device itself, again, these are components that are in all of them, whether they be a really expensive vape device, a tank or a mod system, or the new disposable devices. They all have a power source, usually a lithium battery. They have something that's called the atomizer that looks like a spring. And that's what these liquids and chemicals travel over. That heats up the liquids and chemicals and creates the vapor that people inhale. Some of the devices are refillable, so you'll see different e-liquids that can be purchased in a bottle or a container that's plastic. Some devices come pre-filled, and in that case, the cartridge or the pod that has the liquid in it may have the atomizer built right into the cartridge. And again, all of these products are creating an aerosol that the user inhales. E-cigarettes have changed dramatically over the years. The first devices back in 2007 that came into the US are on the far left, actually looked like a traditional cigarette. It only had nicotine cartridges of different levels. There were no flavors involved. And because it looked like a cigarette and was pretty expensive, it came in a gift package anywhere from $165 to $300. It was pretty cost prohibitive to kids. And it wasn't, looked like a cigarette. So it wasn't of any interest to young people, plus no flavors were involved. A few years later, you have the center image, which is tank or mod systems. They're called mods because they're modifiable. You can get different size batteries, different size mouthpieces. This is when the introduction of flavors that people could refill a device with came out. Again, these were pretty expensive types of systems at the time, over $100, depending on the metal you chose, and again, how big or small the battery was, the power source. Then moving forward, more recently, we've heard a lot about disposable devices, and there are all kinds of these, and these are very affordable to people of all ages. In some cases, they're on sale, 2 to a pack for $4.99. A lot of them are sold for under $10, and they have what they call a pre-filled cartridge. It's all enclosed, and basically it's 200 to 300 hits of nicotine. Then you get rid of it. And unfortunately, a lot of times people are throwing them on the ground. So the evolution, the first generation, again, looked like the cigarette. Second generation, they pre-filled or refillable cartridges. Tanks or mods were considered the third generation. A couple years ago, a lot of people heard about Juul. That kind of got people's attention. That's a pod system. People buy the flavored pods and put it into the device. That was popular with young people for a while. You heard about kids saying they're going to the Juul room instead of the bathroom, or people were sharing devices on school campuses. Again, trends now moving forward are more toward the disposable devices, which do have flavor options. So just some things to keep in mind, and some things we like to remind people of all ages about. These aerosols can contain harmful chemicals. It's not just the nicotine and just a flavor in there. There's an assorted group of chemicals, anywhere from 6 to 60 compounds. You need these other chemicals to get the device to work. Most of them do contain nicotine. There are very few vapes that are sold that are nicotine-free, and very few e-liquids that are nicotine-free. A lot of the chemicals that you hear about, or excuse me, the flavors you hear about, they're promoted as like cotton candy, gummy worms, lifesavers, chocolate, just anything you could imagine, like the Ben & Jerry's ice creams. Well, when we talk about these flavors, we have to remind kids that these flavors that these companies are saying are approved, they're approved by the FDA for food. They're approved for use in foods that we eat and digest. They are not approved or tested to be mixed with other chemicals, heated up and inhaled. So that's a big difference between FDA approved flavors for food items versus FDA approved flavors being used in something that they're not tested in. And currently at this time, and for the last few years, e-cigarettes and vapes are the most commonly used tobacco product by both middle school and high school students. So the other thing that's noticeable when we talk about these aerosols, you're talking about nicotine liquids that are thick and heavy. When you see some of these e-liquids, they look thick, they look oily, they're sometimes amber in color. They can change the different colors depending what other chemicals are in them, but they're thick and heavy and sticky. Well, the same thing happens in the aerosol. It produces an aerosol that has tiny sticky particles in it. If you see someone vaping a lot in an enclosed environment like a car, Just like cigarettes, you can get a film over the inside of the windshield over time. You could also get some stickiness on the dashboard. Again, you've got to think of what these chemicals are that they're starting with and how the person that's using it is exhaling it, plus the aerosols coming off the device itself. The other concern is the tiny metal particles that people are inhaling. When we talked about that atomizer, the heating coil, as these liquids travel over the heating coil, potentially the metal finish wears off some of these parts. It gets into the aerosol that the person inhales. If, again, people are using these devices in small spaces, just like cigarettes, if somebody has asthma and they're in a small space with somebody vaping, it could trigger an asthma attack. It could be irritating to somebody that has a lung condition. The history of e-cigarettes, they originated in China. It was actually supposed to be a health benefit. There was a pharmacist that was trying to help his father quit smoking. His intention was to gradually decrease the amount of nicotine that his father used through the electronic device. They came into this country in around 2007 as imported devices. They weren't fully regulated. Again, it was one of those things that entered the country and was getting sold and used before people really realized it was here. In 2008, the World Health Organization ruled that electronic nicotine delivery systems were not a legitimate smoking cessation aid. Here in the US, there is still no e-cigarette that is approved for smoking cessation. So that's something to keep in mind. As much as they say they help people quit smoking, none of the devices have gone through the application process and passed it yet to be approved as a smoking cessation tool. In New Hampshire, we were a little bit ahead of the game. We passed e-cigarette legislation back in 2010, prohibiting the sale of e-cigarettes to minors. Back then, it was if you were under 18. A few years ago, the FDA started looking into these devices. They fully regulated all e-cigarettes as tobacco products. So that's something, too, that a lot of younger people don't realize. They are regulated as tobacco products. So the age restrictions, the Indoor Smoking Act, some other things that regulate tobacco in this state and in the country also apply to e-cigarettes. In 2018, Juul kind of came under the watch of the FDA. The FDA passed some regulations. They warned Juul about some of their sales mechanisms and marketing. And they removed some of the flavors that Juul was selling in regular retail locations. The age nationally for tobacco sales went to 21 back in December of 2019. However, individual states needed to pass their own legislation as well to make it more possible for enforcement. It's very different. Our enforcement of tobacco is done through our state liquor department. That's who does the enforcement of tobacco ages and sales, and also the tobacco's tax stamps and all that stuff falls under liquor. People were not necessarily enforcing the age for underage sales, but recently here in New Hampshire, the age for sales was changed in July of 2020. So it's now 21 years old for sales of tobacco products, whether it's the federal guidelines or the state of New Hampshire guidelines. And this just shows you some other kind of standing marks in history, marks in timeline where bans were announced. There was a flavor ban announced in January of 2020, but it only was for cartridge-based systems other than menthol. So people thought, oh, we did away with all the youth-friendly flavors. Well, we did not, because it only applied to certain types of devices. So again, the big thing is just to remember and remind people that the industry itself is not fully regulated, that all vapes are considered tobacco products. Additional regulations are pending. There's over 450 device brands and styles and types. This is why it's very hard to regulate. And there's thousands of flavors in this industry. And then we'll show you some of the examples of some of the products in a second. So some of the news data points that have come out recently is there are a couple surveys that are done nationally and in the state. A lot of these are given within the states and then sent to the CDC to be published nationally. There was a study done in 2020. It was January, February, March of 2020. The good news was that it showed a decrease in youth vaping for high school students. However, it was a very shortened study because it was only 3 months and it was prior to all the schools going to homeschooling or learning remotely. So we don't really know what happened during these last few months of COVID and kids having to learn from home, the stress, the anxiety associated with so many changes to their daily lives and their schedules. So again, it's good news that some of the rates went down, but on the other hand, some of the individual statistics that they were looking at, things went up. For example, the youth use rate for frequently using e-cigarettes is up to 38.9%, which is high. That means using multiple times in the one 30-day period. And in this case, they used the reference 20 or more days of use in the past 30 days. So that's a pretty high statistic, unfortunately. The other thing is the high rate of dependence on nicotine. And this is because a lot of these disposable devices and cartridge-based devices have more nicotine in their products than cigarettes do. And kids tend to inhale and use these, adults too, in places where cigarette smoking is not allowed because they're taking a quick hit off a device. You don't have that tobacco smell that you would from a traditional cigarette. So in a lot of cases, vaping is done quickly. It's done in places where cigarette smoking might be noticeable, so people don't do it. So again, that's showing up as far as youth having trouble quitting or youth being concerned that they can't quit using these products. These are just some statistics from another year prior, just showing what the high school and middle school use levels were at that time, e-cigarettes versus traditional tobacco cigarettes or combustible cigarettes. So again, people of all ages, like from 25 and under, are leaning more toward the vape devices than they are traditional cigarettes or the smokeless tobacco, the snuff, the chew, the dip, the snooze. Here in New Hampshire, unfortunately, the last youth risk behavior survey done in 2019 showed that we had one of the highest youth rates in the country. Our use rate was 33.8%, almost 34%, but we also have to realize that 66% of the students in New Hampshire that were surveyed said they did not vape. So again, more said they didn't vape. However, our number is pretty high, and that's of concern. And again, with all the changes dynamically for not only students, but for families and adults these last few months, it's going to be hard to know what the ups and downs are for these last few months. And we don't even know if they're going to be able to do the youth risk behavior survey. It's done every 2 years. We don't know if schools are going to have the ability to do this when they're in a remote or hybrid learning format. And these are just some numbers specific to New Hampshire. So you can see this is just a 2015, 17, and 19, just how things went up and down, 9th, 10th, 11th, and 12th grade. These numbers are all available. They're done by county and region. You can go to the Department of Health and Human Services website, and you can Google New Hampshire YRBS, and you can get links to your communities, and you can get these 3 years worth of data on the website. So a concern of ours, of course, is nicotine, because nicotine is toxic. It's highly addictive substance, whether you get it from vaping, combustible tobacco, or smokeless tobacco. The nicotine that's in these vape liquids is also naturally found in the tobacco leaf. They are using that right now. It's a cheaper way to get the nicotine than it is to make it synthetically. So it is, the tobacco leaf source is the primary agent in both the regular cigarettes and in e-cigarettes or vape devices. what young people may or may not understand is the impact and the effect of nicotine on the brain. Just like some other drugs like cocaine, heroin, and alcohol, nicotine triggers the reward center of our brains. Our brains are still developing into our early to mid 20s. And the reward center of the brain, the front part of the brain, is one of the last parts of the brain to develop. So when you introduce a substance that triggers the reward center of the brain or sets it off, making you feel good, because when you trigger the reward center of the brain, it naturally releases dopamine and adrenaline, which are good things that make us feel good. But when you trigger that reaction by using the substance and you have that feel good feeling, you want to return to it. So that's why a lot of people, you hear of people who have smoked for 20 or 30 years who may have other health issues, but they have an extreme amount of difficulty trying to give up cigarettes or other nicotine-based products. So again, when your brain is still developing, it can impact your brain activity, and how your brain develops. We try to make a point to young people that you cannot get a new set of lungs, you cannot get a new brain. They need to understand that the impacts to your organs that you make now can also affect you for the rest of your life in some cases. We know from many years of tobacco studies, cigarette studies, we have like 40, 50 years of studies about the impact of combustible cigarettes. We know how nicotine works on the body. We know the long-term health impact, the short-term health impact. With vaping, it's kind of a new thing. We don't have 30 or 40 or 50 years of studies. So there are concerns that people that start vaping now and continue vaping for 10 or 15 or 20 years, we don't know what's going to happen long term. Unfortunately, we've seen some short-term health impacts, which we'll discuss. Another thing to keep in mind, that with these e-liquids coming in colorful packaging or being in devices that look like they're fun or look like a pen or look like makeup, young kids are sometimes being exposed to these products by accident. Less than half a teaspoon of a nicotine-containing e-cigarette solution can be fatal to a toddler. Again, it's so strong and toxic to a small child. There have been accidental poisonings. Some of the devices leak, a kid will pick it up, or they'll touch a counter or a table surface where somebody has refilled the device, or device that leaked was on the table, and then the child puts their hand in their mouth or their fingers in their mouth or their eyes. Same thing can happen with an adult. Accidental exposure, if you get the liquid on your skin and then transfer it to your eyes or your nose or your mouth. There's also been some accidental poisonings of small pets. When we talked about the flavors, pets are attracted to the sweet smelling substances at times too. You know how people give their pets treats. You go to an ice cream stand in the summer and you can get the doggy dish or something. Well, pets tend to lick up some of these sweet smelling liquids too. So there's been some accidents with pets as well. Again, we can talk about all the effects of nicotine. These are just some of the summaries of withdrawal symptoms and the effect of nicotine too, why you go back and forth. Again, you have that initial, you may feel more alert from using nicotine, but then you have, after it wears off, after about 30 minutes or so, then you need more of it to feel the same way. So people go back and forth. Unfortunately, for teenagers, they may have less severe withdrawal symptoms when they try to quit, but it's going to happen much sooner for them because their brains and their body are still developing. So when we talked about the levels of nicotine in some of these products, Juul, we're using them, we're not promoting them, but that brand was one of the first companies to come up with what they call a nicotine salt solution. It's still a liquid, but their development of this product allowed for a less harsh hit to the user to the back of the throat. For kids or young people or people that don't smoke to try these products, if you smoke cigarettes for its first-time user, sometimes when they inhale, there's a harsh hit to the back of the throat. With some of these vaping devices, they don't experience that harsh hit to the back of the throat with some of these formulas. So they are more apt to continue using these products or continue to try them versus cigarettes. This is where you get into some of the mistakes made by young kids touching bottles or something, or picking up different packaging. The image on the right where it has the, it's called blow sauce. When they came out a few years ago, one of the things they did was to offer a coupon for your next purchase. Well, the colors they used very closely mimic the box tops for education that a lot of companies were doing, where you turned in a box top from a can of soup or cookies or crackers or something, and the money went toward education. Then you see on the right-hand side, you see just different brand names. These are all e-liquids, Max Loops, Berries, Max Fish. It looks like Swedish fish. So a lot of these were popular fruit flavors, and in some cases, they looked like cereals or candy that were common to kids. So when we talked about the levels of nicotine, this is just to give you some idea when you compare some of the pod devices to traditional cigarettes and how many cigarettes it would add up to. When you look at the volume, it kind of really makes an impact. Like one Juul pod is the equivalent amount of nicotine to 20 to 41 cigarettes. So in our country, a pack of cigarettes is 20 cigarettes per pack. So you're talking over 2 packs. And then on the far right, you see the Soren pod. Depending on which nicotine pod someone chooses, it could be the equivalent to 90 to over 100 cigarettes. So the content in disposables has been concerning too, because again, these are they're colorful. They kind of look like an innocent thing. They're the size of a flash drive or something similar like that. A lot of fruit flavors. These were not part of the FDA law as far as the cartridge flavors and the pre-filled pods. These are a self-contained device, so it's pre-filled. It's initiated by inhaling it. That's how you turn it on. You inhale off the mouthpiece. There's no on or off switch. When you stop inhaling off it, it shuts off. Unfortunately, the way they're packaged, we've seen more of these thrown on the ground, like when people sometimes discard cigarette butts. So it's becoming an environmental issue as well as a health issue. A few years ago, there were some studies done where were the e-cigarettes sold. So again, even Juul was sold in some of these locations, convenience stores. You do not have to go into a vape shop to purchase these items. And that's unfortunately what a lot of people think, because the vape shops supposedly and are pretty consistent when they testify, they do not sell to anyone under 21 now. But this is not where kids are necessarily shopping for these devices. You can get them online. You can go to any of these quick marts and find quite a selection of disposable devices or even Juul devices and similar things. So again, with nicotine and addiction, and Andrea can probably elaborate more on this at the end. For some people, again, you're triggering the reward center of the brain. Occasional use can lead to more regular use. And for some people, it leads to total dependency, and they have very difficult time trying to quit, whether it's nicotine or other substances. These are, again, just some images so people can see what the variety is out there. And again, these flavors that are being promoted that look like Sour Patch Kids or look like candy, these flavors are made to be ingested and processed by your system and digested over time. They're not made to be heated up and mixed with other chemicals and inhaled. Some of the other chemicals that are found in e-cigarettes, not every e-cigarette or every e-liquid contains these, but these are some of the common things that show up. You have things like rubidium that's used in fireworks, ethylbenzene that's used in paints and pesticides, acetone, nail polish remover. I mean, if anybody has done their own nails or been in a nail salon, you know how strong nail polish remover smells. Again, nicotine is quite common, even in products that are labeled nicotine free. Some of them have shown trace amounts of nicotine, formaldehyde and propylene glycol are a couple other chemicals that commonly come up in studies. So when we talked about disposals and finding these things on the ground, the Environmental Protection Agency has come up with some outlines. But again, you're talking about landfills being able to handle these materials. They're getting thrown into the regular trash a lot of time, and you have to remember that there is a power source, there's a battery, plus there's residue from the other chemicals in the device. So again, this is something we're probably going to be dealing with in the future as more and more of these things end up in our trash. These are just some of the other chemicals that can be in aerosols. And again, when you're heating up chemical mixtures, in some cases, you're creating a whole new chemical composition. One of the other concerns is the increased use in marijuana products through vaping. There's also an increase in dabbing, which is using something that has a waxy consistency. In some cases, there are special vape devices specific to using dab. In other cases, people were taking apart some of these vape devices, and they're not meant to be taken apart, and they were putting the dab or the shatter right on the heating coil and inhaling it directly off the heating coil. Similar to the nicotine levels that have increased over time, THC levels have increased dramatically over time. It used to be that 10% level of THC, which is the psychoactive component from marijuana, that used to be strong. And nowadays you can find products that are 80 to 90% in strength. So it is a concern. You have neighboring states that have different marijuana laws across the country. In some states it's legal. It's still not legal at the federal level. Again, side effects, and just with young people, we need to mention too that they can suffer from impaired judgment, just like you can with use of alcohol. They need to understand that they may be putting themselves or others in harm's way or at risk by inhaling and using THC products. This is just to show you too, there's a new product market out there. There's pre-filled THC pods. The entire back panel of this carton is a warning label. How many of us don't really read warning labels on some products as adults? So you can't expect a young person to read the entire warning label either. But unfortunately, this is a common product that's out there. Again, as a lung health organization, we are focused on lung health as well with these products. Your lungs, like your brain, are still developing into your early 20s. So the less stuff that we can ingest, I mean, we're exposed to so much. Our lungs are our body's filter. Just environmentally here in the Northeast, we have to, you know, this time of the year, coal burning stoves, wood burning stoves, pellet burning stoves. There's all kinds of stuff out there in the air. We're on the prevailing side of the winds as far as they come from the West Coast to the East Coast. So we get a lot of stuff in the air in the Northeast. So the less we can do to add to what our bodies have to filter out, the better off we are. We do want to mention, you've heard, you're overwhelmed, you've probably fed up with hearing about COVID-19 or coronavirus. We just want to put a reminder out there because that is something that affects your respiratory system. If you are vaping or smoking, you are more apt to get any type of virus, whether it's coronavirus or anything else, anything that's connected to your respiratory system. When you smoke or vape, you're irritating your lungs in general and inflaming the tissue. So overall, you are potentially more susceptible to viruses like this at any age. And then one thing we need to remind young people of, for years, we've said don't share your water bottles just because you could pass along, you know, pneumonia, strep throat, mono, all kinds of things. Well, you shouldn't share vaping devices either for the same reasons. But now, especially when it comes to something like COVID, you don't want to be passing around a vape device and sharing it in a social situation. There's also a concern we've talked about with COVID, the respiratory droplets. Well, when you're inhaling an aerosol and then exhaling it, potential to pass along these respiratory droplets in this aerosol is also high. Prior to COVID, one thing that was being studied directly related to vaping was EVALI, which is the e-cigarette vaping and acute lung injury study that was going on. It ended in February of 2020 due to the focus on everything else that was going on. Up to that point, there were over 28 confirmed hospitalized cases of E-Valley around the country. All 50 states had indications of it. There were 68 confirmed deaths, people of all ages. I believe the youngest was 15, the oldest was 80 as far as deaths. What it was backtracked to eventually was a lot of the people that were hospitalized, but not every single person, but a lot of them had used some form of THC product that had vitamin E acetate as an additive. What vitamin E acetate does is it thickens things. So you're thickening or extending a product by adding it to something. Vitamin E, we all know you can take it, use it topically, you can take it as a vitamin, but when you're talking about, again, heating it up, it's an oil-based liquid, you're heating it up and mixing with other chemicals, then it becomes not so healthy. One of the really outlier cases, but something that did happen, is you had a 17-year-old that had to have a double lung transplant due to vaping, and he had not vaped for a very long time. He was in Michigan. So for somebody that age to go through a double lung transplant is very uncommon. Unfortunately, double lung transplants don't last forever. You're looking at potentially having to have another type of surgery in 8 to 10 years. And again, this young man had not vaped for an extended period of time. Since this happened, he was actually interviewed on Good Morning America and some other news shows. So he did go through the surgery. He made it fine. The image on the left is his lungs prior to surgery. You can't even really tell that they're lungs. And then on the right, you can actually see the outline of the lung lobes and can actually see the lungs. So there's all kinds of products out there. Again, hundreds of them. These were a few that were common a couple years ago. Again, we're not promoting any of them. It's just so you can see some of the variety and how small they are. This is the thing that caught my attention now. This is what's popular. Again, the price range. They're not price prohibited. And look at all the flavors and how colorful they are. Hyde, Puff Bar, Stig, Six. There's all kinds of things out there. And these, you know, in price range, $3.99 and up. In some cases, they'll have a special buy one, get one. Again, you don't have to go to a vape shop. You can find some of these at a 7-Eleven or a Cumberland Farms. So they're not hard to find. Thing that came out 3 or 4 years ago, again, this is not something that kids were buying because of the price, but the fact that a company was promoting something, they marketed it to look like an asthma or a medical inhaler, and it does, but it's actually a vaping device. Unfortunately, something like this, if you see a young person with it, you're not going to question it. You're going to think it's a medical inhaler, the way it looks. Other accessories that have come out, smartwatch vaporizers. You can see the mouthpiece at the top of the device, and it looks like a watch. Accessories, they're wraps, just like people do things for their phones to distinguish them or personalize them. There are all kinds of accessories that you can put around your vape device. Other accessories that were developed over time, and then something that specifically puts it on the back of your iPhone to hold it in place. There's a clothing company out there that's devised a whole section and line of clothing where you can actually restring the hooded part of the sweatshirt with their vape tubing, and you put the vape device inside the sweatshirt in a pocket that they've sewn in there. They also sell things that look like camelbacks that you can take these things, and they market it as being used in outdoor settings, you know, where you would normally go hiking and stuff, which unfortunately, again, just popularity makes it look like something else. Puff Glove came out not this winter, but last winter. They have 3 types of gloves, saying you can conveniently hold your USB drive. I don't know how many people go hiking or skiing with a flash drive, but obviously other intentions, but they can't really come out and say that. Again, the flavors are a big thing. The e-liquids are in the red squares or above the red squares, but how closely they resemble some common everyday items we see in grocery stores. The big thing to us was the juice box on the lower left, the fact that they so closely mimicked an apple juice box that young kids are used to getting. We actually bought some of that e-liquid, I think it's been 3 years ago now, in a local vape shop, the apple flavored one. Here it is. This is stuff that we've purchased locally just for examples of some of the flavors. The one that says candy treats, it looks like something you'd get in Michael's or cake decorating aisle. That's not what it is. It's a vape liquid. So one of the issues from a public health standpoint is we do feel that the flavors are strongly at the eye of the storm. In other words, if you remove the flavors, would as many young people or young adults try these products? Probably not, because again, the flavors diminish the harshness of the chemicals and of the nicotine in the vaping process. These are ads that have appeared over time. What caught our attention was 2 years ago, the back to school ads that came out for vape devices. Obviously, they're not looking at the kids' parents or grandparents that are going back to school. They're directed at a young target audience. They make this look like it's socially fun. They focus on the flavors. A lot of well-known people have been in some of the ads over time. Youthful images are used. Again, this is Juul's big campaign, which they've stepped back from a little bit the last couple of years or the last year and a half. But they were one of the first groups to do such large-scale marketing. Years ago, we had issues with cigarette ads that were using cartoon characters and well-known people going after a younger market. This is a cool cigarette ad on the left from the 1990s and a Juul ad from 2016 on the right. So it's almost the same image side by side, just updated with a model from the current period and a vape device in her hand. CDC has had a lot of messaging out there, national campaigns, trying to remind people that nicotine can cause addiction and may harm brain development. So you have kind of the big 3 or 4 components to the increase in youth use of vape products over time: lack of regulation, lack of enforcement, advertising in places where traditional cigarettes and other tobacco products cannot advertise. You still see some vape product ads on TV. That's right now, that's one of the gray areas or loopholes. And again, the big focus on fun looking devices and also the flavor variety. A couple years ago, there was a study done. They asked young people who use Juul flavor pods, where did they get them? A lot of them were talking about retail locations. Those were the places we mentioned, whether it's 7-Eleven, Cumberland Farms, Rite Aids, places like that. They didn't have to sneak by and order them online. They weren't getting them necessarily off the black market. In some cases, when we were doing live presentations, we had parents say they had purchased a Juul for their son or daughter, not realizing that it was a nicotine product. They thought it was a flavor only. Here in New Hampshire, we've, again, as I mentioned earlier, we passed regulations over time. Most recently, as of July 30th, New Hampshire tobacco sales and possession age is 21. Again, in 2019, that was the US age, but it's now more enforceable on the local level if it's 21 in your state. Probably now a year and a half ago, RSA 126K was updated so that no tobacco products can be in possession by anyone on New Hampshire public school grounds. This includes cigarettes, vapes, e-liquids, the devices, and even the empty cartridges. You shouldn't have any of that on your person when you're on public school grounds. Again, we keep mentioning and harping on the public health concerns, but those of you that have worked in substance misuse, you probably know these all by heart. Smoking is still the leading cause of preventable death in the US. And then a lot of people start, in fact, 88% of adult smokers start before the age of 19 or 20. I'm sorry, I can't see my screen. So then the other issue, if people start vaping at a young age, again, because of the flavor attraction, if they introduce nicotine at a younger age, they are more likely to transition to another type of nicotine or tobacco product. Again, it just changes the way your brain works and what your brain expects and looks for. So potential signs of vaping does not mean somebody is vaping. These are just some things that were seen by pediatricians over time. The process of vaping dries out the tissues in your respiratory system, in your nose and your mouth, just because of the chemicals involved. So the American Academy of Pediatrics has come out with some statements of their own. Again, just warning that e-cigarette companies do target kids, especially with the flavors and the packaging. There's a lot of chemicals involved in these products. And then the other thing to be concerned with, exposing other people, like secondhand smoke, thirdhand smoke, we're exposing other people unintentionally to secondhand aerosol. And third-hand aerosol, because again, you have this very sticky liquid to start with, and that's what's getting out there in the droplets. So with tobacco, cigarettes, combustible products, we had done a good job changing knowledge and changing the environment and awareness, either through policy or education, changing the norms. So fewer people were smoking cigarettes or taking up cigarette smoking. Unfortunately, with vape devices and vaping, we're at the beginning of this process where we have to share more knowledge, create more awareness, and change the environment of where people use these products and how they get to them or get access to them. So the big thing for parents and people that work with students or teenagers or young adults is just trying to share some information, make them aware of some of the dangers with these products. Here in New Hampshire, there is a quit line specifically for people under the age of 18. My Life, My Quit is that resource. This is hosted and sponsored by the New Hampshire Department of Health and Human Services Tobacco Prevention and Cessation Program. So it is a vetted program. It's not ours, it's the state's. This is in 19 states right now. Again, for youth under the age of 18, they will get a live person, a coach to help them with questions, to help them with the process, and to share resources that they can do. Again, the parents don't call this line. This is for the young person themselves to call. For adults, so over 18, same process. This is Quit Now New Hampshire. This has been around for a long time. Again, you get a quit coach, somebody that's been trained to help people quit smoking and to provide them with resources. If you're over 18, there's potentially the option to get some free nicotine replacement therapy. It depends on what's available in the program and what's available through the state budget. So again, this is for 18 and over. And then the Truth Initiative is a national organization that has their own app called This Is Quitting, that's for young people and young adults. So I'm just going to go to the end, make sure I allow a few minutes for questions. I don't know, Andrea, if you want to add anything about the nicotine addiction piece or anything you've noticed or read or heard.
Sure. First of all, thank you, Kim. That was great. I learned so much from that, and specifically very disheartening to see the different products that these companies have come out with to allow youth and people to essentially hide the vaping. I hadn't seen that before. Can you still hear me? I just had something pop up
Yep.
that says my internet was unstable. Okay. Yeah,
I can hear you, yes.
The only thing that I really want to share is I think youth really don't understand how habit forming a nicotine addiction is. So you talked, Kim, about how it can take people so long to quit the nicotine. And even after the nicotine's been out of their system and they don't necessarily have that addiction anymore, it's just this habit that's very difficult to break. So I can see why switching over from a physical cigarette, maybe for the older people, the vaping is not great because it still forces you to take that deep breath and that exhale, which is very much can be addicting as well for people, that habit. So that was just one thing that that's always stuck with me. I used to do prevention work when I was fresh out of undergrad, so well over 10 years ago. And that was something that people always said and really stuck with me. And like Kim had mentioned, unfortunately, at this point, the YRBS data from 2016 is pretty old. So the only thing that I can really share, let me just pull up something, is that from 2017 to 2019 in the Upper Valley, at least, we have seen an increase of over 11% of youth use rates of e-cigarettes. And then for anybody that maybe is from the greater Sullivan County area, they are up 16.5%. So that's pretty alarming. Like Kim said, you have to think of the other side of folks, of, our youth that are reporting that they aren't using, and that's still really great. But the fact that we're seeing that increase of 11% or over 16% is very alarming. So I think at
One
this
thing
point,
that I didn't mention, sorry, Andrea, is dual use, which is a concern for those adults that are trying to quit using combustible cigarettes that are vaping. What was happening for some of them is they would smoke cigarettes in their car or at home and then vape at work, because in some cases they could get away with vaping in a work environment without leaving the office or without leaving the building. So they're actually increasing their intake of nicotine instead of cutting it down or reducing it. So that was another thing that's come up. Again, it does work for some people, but the best way to quit using any nicotine product is to talk to a healthcare provider or professional or a quit coach. Even, it's just so difficult to do in general, but it's extremely difficult to do it on your own. But there are occasionally, like anything, there are people that sometimes do have success doing it on their own. But yeah, the dual use is a concern for those adults that are trying to quit smoking cigarettes.